everyone, welcome back to Medical Dr. B. Now, if this is your first time here, this channel breaks down ideal medical topics, especially things you will actually use in clinics, exams, and real patient conversations. Okay, so today's topic is one that medical students fear. Yeah, patients have a lot of misconceptions about it, and examiners absolutely love it. It's an examiner's delight. So what am I talking about? So OCP counseling is easy. A complete guide for medical students and also young doctors. Okay, oral contraceptive pills counseling. By the end of this video, you should be able to confidently counsel any patient on OCPs. You should be able to answer common patient fears and needs. Sound clear, professional, and empathetic in your OSCEs and also real life scenarios. So let's get into it. Okay. What is OCP counseling? Now, OCP counseling is not just about saying, take one pill daily. It's about explaining what the pill is, how it works, who can use it, who should not use it, what are the side effects, and addressing patient concerns. Now, in exams and clinics, how you say it actually matters. So let's dive right into it. The first thing you need to think of is introducing the consultation. So step one, start with rapport. I would like to talk to you about oral contraceptive pills. Explain how they work, their benefits, possible side effects, and answer any questions you may have. Now, what should you always do? Always confirm the patient's age, pregnancy status, breastfeeding status, medical history, their smoking status, current medications. This shows safety awareness, which examiners love. Now, what's step two? You need to discuss the types of oral contraceptive pills. So, you explain simply, we have the combined oral contraceptive pill, the OCP, which contains estrogen and progesterone hormones. Then we have the progestin-only pill, what we call the POP or mini pill. Now, you're going to explain that both are effective. Choice depends on medical conditions. Now, you need to be patient-friendly in this situation and mention there are different types of pills and we choose the safest one for you based on your health. Step three, how OCPs work. So this is very high. You explain to them that OCPs prevent pregnancy by preventing ovulation, thickening cervical mucus, thinning the endometrium. Now, in a patient-friendly conversation, you mentioned that the pill works mainly by stopping your ovaries from releasing an egg. Now, making it harder for sperm to reach the egg, and also making the womb lining less suitable for pregnancy. Then we'll move on to step four. What are the benefits of OCPs? This is meant to reassure your patient. Now you go to contraceptive benefits. They are highly effective when used correctly, and they are reversible. Now, what are the non-contraceptive benefits of OCPs? 1. Regular menstrual cycles, reduced menstrual pain, reduced heavy bleeding. It improves acne. It reduces the risk of ovarian and endometrial cancer. Now, you explain in a patient-friendly manner that apart from preventing pregnancy, many women notice lighter, less painful periods. All right, let's go to step 5. We cannot talk about the benefit without talking about the side effects, right? Good. So what are the side effects? Let's start with the common side effect. Don't forget, you need to be honest but calm. Now, 1, nausea, breast tenderness, headache, spotting between periods, mood changes. I know you guys are going to clock it, and then mood change. Yeah. So you reassure that most of these improve after the first 2 to 3 months. Okay, let's look into more serious but rare side effects. So take a look at blood clots, like in the case of DVT, deep vein thrombosis, or pulmonary embolism, stroke, hypertension too. So, but I want to teach you one mnemonics that'll be very helpful when it comes to side effects. It's called X. A for abdominal pain, C for chest pain, H for headaches, E for heart problems, S for severe leg pain. Step 6. Okay. Step 6. Who should not use combined OCPs? Now, this is very exam relevant. We're talking about the contraindications. They include someone with history of blood clots, someone with a history of migraine with horror, uncontrolled hypertension, smokers, especially those over 35 years old, breast cancer, severe liver disease. You say in this format, in some medical conditions, we may recommend another safer option. Simple. Now, we cannot talk about all this without looking at some myths. So what are the OCP myths and patient concerns? The common myth: the pill causes infertility. The pill makes everyone gain weight. You need to rest from the pill. So you correct gently by saying fertility usually returns quickly once the pill is stopped. Now, step 8. When to seek help. You advise patients to return if there's severe side effects, signs of blood clots, persistent bleeding, missed periods with pregnancy symptoms. Okay, so let's summarize quickly in closing. Quick recap. OCPs are safe and effective. Proper counseling improves compliance. Individualized choice is key. Always address patient fears. Now, medical students, please don't forget to ask your patient if they have any questions or concerns after counseling them. And then you explain that you refer all the findings to your attending. Now, if you found the video helpful, please like, subscribe, comment, share, please share with your fellow medical students, young doctors, whoever was inquisitive, even having more knowledge medically. Thanks for watching, and hope to see you in the next episode on Medically with Dr. B. I would like to talk to you about oral contraceptive. I would like to talk to you about